Good afternoon, everyone. As Prof has already introduced me, I am Rathebile Moshoeshoe. I did a study on institutional arrangements around counterfeit medicines and quality and policy. So I'm going to start with the background. So what are counterfeit medicines? I think it's important to first discuss what the definition of counterfeit medicines is, especially in relation to my study, because there has been many different definitions and a lot of amendments have been made. So under the study that I did, we are looking at these keywords: substandard, unregistered or unlicensed products, and falsified medicines. What do we need to supply to secure the supply chain? Are we safe, as Prof has already asked? And the answer is no, we are not safe. Over the past couple of years, there has been an increase in the incidence of counterfeit medicines globally. And the countries of origin that have been identified as culprits is India, primarily India at 53%. This was a study that was done in 2020. And this one on my right was done around 2014. So India seems to still be leading in that. And as we know that most of pharmaceutical products are produced in India, especially our generics. China is number 2, ranking at about 30%. The United Arab Emirates trailing at number 3 there, about 4%. Hong Kong at 4% as well, and other countries that have not been mentioned in this particular pie chart, but we can see what those countries look like on my right. Estimated cost of loss of revenue in the US, according to a study that was done quite recently, shows that counterfeit medicines are costing a loss of revenue in quite large amounts of money. Okay, so what are the enabling factors? Why is there such a rise? If you look at market characteristics, counterfeiting is profitable, as we have seen in the previous slide, and there's a huge demand for various reasons, such as accessibility of high quality medicines. As we know that high quality medicines are expensive, for one. Brand power. Pharmaceuticals have a very high level of brand recognition in comparison to other products. Production and technology and distribution. Well, there's very low investment required. Most counterfeiters use low cost, simple equipment to do their counterfeiting. Marketing is easy. There's different ways to infiltrate existing channels. The use of internet as well is a huge one these days. It's easy to conceal operations because most of these counterfeiters operate in very small networks, and they are using sophisticated technology these days as well. So visually, one product that is counterfeit can look very, very similar to one that is an original product. So retailers and consumers are deceived alike. As far as institutional characteristics have been seen in different researches, we can see that generally what makes it appealing is that there's a weak legal and regulatory framework in many countries. There's weak enforcement efforts, and penalties or sanctions are very low. It's usually a manageable business cost. What is the impact? Well, as far as economies of countries are concerned, because of tax evasion, there's loss of revenue due to drug resistance, and loss of treatment outcomes. Countries are also losing a lot of money investing in the healthcare system. There's also loss of trust in healthcare systems and programs amongst individuals. And you may also find that there's loss of income also as far as individuals are concerned due to prolonged illness or death, because sometimes counterfeiters use toxic medication, toxic ingredients, pharmaceutical ingredients. Sometimes red poison has been found in some products. As far as pharmaceutical companies are concerned, there's a loss of revenue, as in the previous slide I have shown, and there are high costs of legal enforcement. with intellectual property rights being quite a big issue right now to secure their products. There's also a loss of investment in research and development due to the fact that companies are losing money to counterfeiting. So I'm going to talk a little bit about the study that I did. I was looking at an assessment of the legislation and policy framework for combating counterfeit medicines in South Africa. So the aim of my study was to assess the legislative and policy framework and institutional arrangements which govern pharmaceuticals and anti-counterfeiting strategies, and to evaluate the level of awareness and stakeholder collaboration. So the methods that we used there were two-phased, where the first phase was looking at document analysis of various public records around government institutions and law enforcement agencies. And the second part was looking at anti-counterfeiting strategies through in-depth, semi-structured interviews with stakeholders involved in law enforcement. The results of my study showed that South Africa does have a good legislative framework that governs regulation of pharmaceuticals. However, there is no integrated policy framework with an implementation framework focusing on counterfeit medicines specifically. So there is a need for an anti-counterfeit policy in order to effectively combat counterfeiting. And the aim of the anti-counterfeiting policy would be to enhance regulatory powers for law enforcement agencies, to mandate harmonization of existing legislation, so that it addresses properly both the criminal aspect of counterfeiting as well as the medical definition of what counterfeiting is, or the public health definition of counterfeiting, as well as mandating stakeholder collaboration, regional harmonization, and international partnerships. So from the conclusion of my study, we can establish that the legislation and policy framework in South Africa needs reframing in that regard. So if we can have a look at this slide that I'm opening right now, this is what the South African supply chain currently looks like. So you've got that first part of the diagram there, showing us the finished product or the API and the process it takes, packaging and warehousing. So the distribution is two-pronged. So we've got Schedule 0 medicines that are accessible to informal traders as well as formal retailers. And as we can see, there's already a gap there because the informal market is not regulated. So the study also found that there is some substandard medication that is scheduled 0 that is being distributed through this channel, as well as some supermarkets, your Pakistani supermarkets and those types of markets. And then as far as APIs are concerned, they go through to the manufacturer. Sometimes they can be imported from outside the country. Sometimes they can be manufactured here in South Africa. Then they go through the manufacturing process, then through warehousing. And this will be Schedule 0, Schedule 6 medicines. This would be your now formal distribution chain as far as pharmacies are concerned, and dispensing practitioners that are registered separately by the Department of Health. So we also found out in the study that there is a huge gap as far as dispensing practitioners are concerned, because this duty has been given to the Department of Health, but due to lack of adequate personnel or staff, this function has not been performed. So the function of inspections among licensed pharmacies is done by the South African Pharmacy Council, and due to jurisdiction limitations, their function cannot extend to. Okay. So this is what the regulatory framework looks like for South Africa. We have the South African Health Products Regulatory Authority, which implements the Medicines and Related Substances Act 101 of 1965. And we can also see the South African Revenue Services and the function that they have there as far as customs and border control is concerned. They employ the Customs and Excise Act, as well as the Counterfeit Goods Act. And then the South African Police Service, which will be now handling the criminal aspect of counterfeiting. They also employ the Counterfeit Goods Act and the Prevention of Organized Crime Act. And then the National Prosecuting Authority as well would look at the criminal element of counterfeiting, and it employs very similar the same legislation actually. So we can see that the combating of counterfeit medicines or securing of the supply chain involves more than one stakeholder, and therefore collaboration is important to make sure that there are no loopholes in the system. So these are the results, a summary of the results of my study. Hopefully this will help us understand a little bit more how everything links up to each other. So the main things that we discovered were adequacy of legislation, institutional and organizational capacity, enforcement and post-market surveillance, and stakeholder collaboration, information sharing, and education and awareness. So I'll focus more on the implications because I think I've already touched on some of the other issues there under sub-themes. So the implication of having an inadequate legislation or having loopholes in the legislation is that penalties are lax in South Africa. There's a lack of harmonization also between existing laws. So every department or every governmental agency that is involved in enforcement does its own inspection, has its own, combat strategy. And there is a lot of duplicity of function because of that. And a lot of also jurisdictional limitations that can inhibit effectiveness in the combat process. Also, the issue of legislation, lack of harmonization of legislation, where the legislation that SAPRA uses is not strong enough when it's used alone, but is more effective if it's used together with, this would be your Medicines and Related Substances Act, if it's used together with the POCA Act and the Counterfeit Goods Act, which doesn't happen commonly. So due to the challenges through that whole process of prosecutions, many cases just fall through the cracks. And pharmaceutical companies are forced to have their own legal routes, like settling outside of court or through arbitration. I have already mentioned that there is a limitation in human resource, so there is a need for training, there is a need for increasing budget for making sure that there's enough human resource. There's also a shortage of accredited testing and QA facilities in South Africa at the moment. So this further delays the process of prosecutions. There's also the issue of corruption as well, and there's also an issue of lack of political will. Okay, so if we're going to be looking at enforcement and post-market surveillance, there is currently weak enforcement and very poor post-market surveillance being done. There's no single point of contact for reporting of counterfeit medicines. There's also a lack of online regulation. At the moment, there really isn't any legislation that regulates the online pharmacy space or selling of online pharmaceutical products. Looking at stakeholder collaboration and information sharing. From the study, we found out that between the different agencies or governmental institutions, there's very poor communication. So with border control and customs, the information that is being collected there is not shared with, for example, the South African Police Service or with our SAPRA. Collection of this information is important because it will enable SAPRA to be able to have a risk-based assessment, and from that risk-based assessment be able to have a strategy of exactly what to focus on, which kinds of people are suspect to be counterfeiters, or activity, is suspect to be due to counterfeiting. So that way it helps, with the process of forensics and tracking. Regional and international collaboration is also very poor. One of the stakeholders that I interviewed under border control explained to me that even if there was material that has been confiscated at OR Tambo, for example, trying to get hold of regulatory authorities or border control in a nearby country, even within the SADC region, is a difficult process because there really isn't one point of contact individual that they can have access to. So it just drags on and on trying to find the right person to report the information to. So because of this, then cases usually just, end up not going anywhere. So there is a need for a more joint international approach or regional approach as far as that is concerned. There are already existing partnerships and collaborations. So I think what is needed perhaps is for counterfeiting of medicines to be included in some of those efforts. For example, the World Customs Organization's partnership with Interpol. Under education and awareness, a lot of South Africans are not aware of what counterfeit medicines is, or the fact that some medication or cosmetics or pharmaceutical products have been counterfeited or are being counterfeited. So there needs to be transparency as far as SAPRA is concerned in protecting the public, but there's also a lack of transparency that was identified between SAPRA and the pharmaceutical industry as far as information sharing is concerned. So in general, there's a lax approach to dangers of counterfeit medicines by departments in comparison to other counterfeit goods. For example, SARS takes other types of counterfeiting in the past. A lot is changing, but in the past, the focus was on other goods like your music, other products that have been produced in South Africa, your arts, and that sort of thing. Okay, this slide just shows the gaps that I have already mentioned as far as the shared inspection function is concerned. And here are my recommendations from the study. It is imperative to develop an anti-counterfeiting policy. It is considered best practice for an anti-counterfeiting policy framework to encompass product and supply chain security, advocacy, engagement and awareness, and risk-based enforcement and threat assessment. Specific policy objectives should include the prevention of manufacturing and distribution of SFs, including APIs, securing the legal supply chain against SFs, to prevent formation of illegal distribution chains, to prohibit importation of SFs, and to participate in the global combat against SFs. Such a policy should also entail restrictions on the trade of pharmaceuticals online and the legal obligations for operating online pharmacies. The second one is to invest in capacity building and training, strengthening enforcement, prioritizing post-market surveillance, and pharmacovigilance, enhancing multi-sectorial collaboration, and increasing public awareness through the use of readily accessible media platforms. So this is just an example of what the US FDA is doing. There's a recent collaboration with Asia Pacific Economic Communities in creating a roadmap or a toolkit on how to combat counterfeiting. So on this slide, we can see that there's quite a lot going on. Nigeria is leading very much, or West Africa as a region in general, in terms of raising awareness, where they are finding ways to involve the public through mobile authentication systems, where the public can be able to scratch off a code of a medical product and check it on their phone if it's listed on the database of the NMRA. We also have Fight Against the Fakes, which is an initiative online that helps with online security.
All right. Well, yeah, thank you very much. So I think what we'll do is we'll go on to the next presenter, and if we have time at the end, we can come back. But there are comments that have been made in the chat box, so maybe you can look at those. So thanks,
Okay.
Rathebile.